The Honourable Member for Kafinsa.
Allow me once again, Mr. Speaker, to thank you most sincerely for the opportunity to make a few comments on this very, very important report. May I thank the chair of the committee. May I also thank the mover of the motion for allowing Parliament to discuss this matter, which matter for many years, Mr. Speaker, has not been able to receive the right national attention in as far as Parliament is concerned. We have discussed issues of infrastructure. We have discussed issues of how to build a hospital. We have discussed issues to do with bridges, roads, and employment. But, Mr. Speaker, we have not given this particular matter the right attention that it deserves. And for me, I feel that one of the reasons we've not been able to do that as a nation, Mr. Speaker, is obviously because of the perceptions that are there, how people view issues to do with mental health. I know my colleagues have handled some of the findings of the report. I'll try and pick out one issue which I feel the committee should have delved into in terms of much detail. And this particular issue, Mr. Speaker, is the issue to do with how people perceive those who have challenges to do with mental health. Mental health basically deals with issues to do with someone's psychological well-being, someone's emotional well-being. These are things that for many years we've not understood as a people. I think for many years we've been made to believe, as Honorable MP for Chimwemwe put it, that those who are facing issues of mental health actually have a very big problem which can't be attended to. So, Mr. Speaker, what am I trying to put across? And I'm happy that the Minister of Health is with us today. The first issue that I feel needs to be handled, that will even allow not only this current government, but of course, future generations of those that will be in leadership to look at this matter differently, is first of all to go into society. If today if we were to go to Mulenga compound as an example, how many people are aware that actually mental health is an issue that could be handled by appropriate health workers? If today we decided, let's take a drive to Ngabwe district, where one of our honorable members of parliament is coming from, they probably have never heard of even the word mental health. Because for many years, we've been made to believe that mental health is this big challenge that has nothing to do with possible cures being identified. So for me, the starting point, Mr. Speaker, as we discuss how much money we should give the Ministry of Health to deal with mental health, the starting point is where we are seated today and the public that is viewing this conversation. How many people are actually aware that mental health exists? The challenges of mental health actually exist. So the starting point, and I want to appeal to the Minister of Health, are we able to design a program? Are we able to design interventions, Honorable Minister of Health, that would allow us to go into the communities, start from scratch, go to the primary schools, discuss with Ministry of Health, discuss with Ministry of Education, where we simplify this simple issue. We try and make people understand that, dear colleagues, if we are discussing mental health, we are discussing a possibility that can be cured. Because, Honorable Minister and Mr. Speaker, if we don't simplify this challenge, these old traditional perceptions will continue. For many years to come, people will still think mental health is not a priority. And I want to agree with the Member of Parliament for Kabwata. He listed a catalogue of things that were picked in the report. But one thing that has to be dealt with as we draw near allocating more money, as we tell ourselves, let us employ more people that would deal with issues of psychology, have we made people aware? The 20% that Honorable MP for Kanchivia was referring to, how many others are actually have never bothered to report their cases to the hospitals? How many are willing today to start off from a house and decide that let me go to a hospital in Mufulira? How many are willing to go to Ronald Ross Hospital today to go and say, I've got a mental health problem? Very few people, Mr. Speaker, will have the courage to acknowledge that they have a problem that needs to be cured. Most of us here grew up thinking that mental health does not exist. I used to think that actually if someone is stressed, It simply means that they have a problem that they can't deal with. But stress is something that is real. And for so many years, Mr. Speaker, and this will continue to be the case if we don't design a program that will take us into Shuangandu. We call a community meeting not to discuss issues to do with a bridge, not to discuss issues to do with a road, trying to focus on the issue of mental health, where we raise awareness, we involve teachers, we speak to the problem. Honorable Minister, if we design that intervention, the next stage is now what has been picked in the report. Resources, other activities, those will fall into place. Mr. Speaker, my submission today is only one, and that submission is that can we try and make people understand what mental health is? If we don't do it, we rush to do other interventions. We assume that the solution is to employ 30, 50, 100 psychologists. Honorable Minister, who are they going to attend to? Who are they going to attend to? They must attend to people that are willing to come forward and say, I have come to Kitwe Central Hospital because I have a mental health challenge and I need help. Mr. Speaker, if people don't acknowledge that they need help, we are not going to make the required progress. So, Honorable Minister, the people of Kamfinsa are submitting that we need to design a program that makes people understand what mental health is, and then the other interventions that the report of the chair and his committee have been able to pick are going to provide the required solutions. I thank you, Mr. Speaker, for the opportunity to comment on this matter.
Thank you, Honorable Member.